Like Becca said, I'm Jacqueline Maison-Pierre, the Executive Director with New Haven Farms. She gave you the intro, so you know all about us now. But so I wanted to just give you a little introduction about who I am and how I came to this work. I'm currently the Executive Director with New Haven Farms, and we are a nonprofit based in New Haven, so not too far from here. And our mission is to promote health and community development through urban agriculture. And I'm going to talk to you a little bit about what that means for us and how we got started. I came to this work as a farmer. I actually met Dina about 8 years ago when I had my first season farming at a farm in Bethel, Connecticut, and I met Dina and I was like, wow, she's a rock star. I want to be a farmer like her. And so I kept farming and then moved away to Maine because we didn't have as many opportunities in Connecticut to learn about how to farm. And so I moved to Maine to learn more about farming, but then came back to Connecticut. So I'm happy to be here in my home state. And promoting this work, although as an executive director, my hands are pretty clean these days, so I have to do it in my spare time. So the farm that New Haven Farms is based in an urban area, and this is a picture of one of our farms in New Haven. And what you're looking at there is the Q Bridge. And so you'll see a bunch of pictures in my slides here that you'll think about the Q Bridge differently when you go over it, knowing that there's a small organic farm close to the base of it that's really doing a lot of good in our community. So I'm talking about farming from a pretty different angle. Obviously we feel, and with CT NOFA, organic farming is really important, but I'm talking about farming from a public health standpoint. So I'm going to speak to you a little bit about food insecurity and how farming can really impact that in both rural and urban areas. So raise your hand if you've ever heard of the term food insecurity. Oh, great. Almost everyone in the room has. That's great. I sometimes talk to people and people haven't heard of that word or that phrase, and so it's coming into the vernacular of what that means. And so the actual definition of food insecurity is the state of being without reliable access to a sufficient quantity of affordable, nutritious food. And I think the most important word in that definition is nutritious food. Because we see in urban areas that people have plenty of access to food. There's corner stores on most corners in neighborhoods in New Haven, but the food that you'll find in those corner stores that are really accessible for our low-income community members is not nutritious. It might be affordable in the short term, but we know in the long term that that food that's unhealthy is going to have large health impacts, but also financial impacts for those individuals and as a society at large. So this infographic I took from the U.S. Department of Agriculture, and it's shocking to see that 1 in 6 adults have inadequate access to enough food in this country. And so the organization New Haven Farms really grew out of those staggering numbers of so many of our neighbors, and particularly in New Haven and urban areas, are struggling with food insecurity. And this ties directly into chronic diet-related disease, which is why New Haven Farms was started and why we grew out of a federally qualified health clinic. This infographic here is from the Center for Disease Control and Prevention, saying that about 1 out of 10 adults in this country has diabetes, but 1 out of 4 of the people who have diabetes don't even know they have diabetes. So it's really shocking to really see, when you see the statistics of these chronic diet-related illnesses that are stemming from food insecurity, that are stemming from our food system that was not built on equality or equity. We are looking at the epidemic and the crisis that we're currently facing. This here is an infographic that's showing the total medical cost in this country in the billions for diabetes. And there's a lot of scary things that you read. 9 out of 10 individuals don't know that they have pre-diabetes. So without going into a whole conversation about insulin resistance and glucose tolerance, basically you can be moving towards diabetes, and you can see with your healthcare provider in blood tests that you could be pre-diabetic, so moving towards being diabetic, but 9 out of 10 individuals that are pre-diabetic don't even know that. So this is all pretty daunting and depressing news, but what gets me up and gets me excited that is this kind of piece of information in the bottom, that if you have prediabetes, losing weight by eating healthy and being more active, you can cut your risk of getting type 2 diabetes in half. And so this is unlike cancer, that we're all exposed to so many things and we can all have our own theories of why there's so much cancer or diabetes. It's very clear why our society is facing so much diabetes. It's the lifestyle change, the fact that there aren't very many people having active jobs, that we're sitting in front of computers, that we don't walk to our neighbor's house, that we're using cars, we're not active, and we're eating this food that our bodies were not meant to eat, all of these processed foods. And so New Haven Farms came about because of the impact, great impact that you can have on your life and on your long-term health outcomes by eating healthy and being more active. And so I'm going to go through a few more infographics here. I get really excited when I think about public health data and all the things out there, and so I wanted to share all this information with you all. So in coming to food insecurity, it impacts people in low-income communities. And when we're talking about New Haven, 35% of residents in New Haven's low-income neighborhoods report food insecurity. And so those numbers are decreasing a little bit, but it's disconcerting to see those numbers. And these are our neighbors. You know, we don't have to drive too far from the community here in Woodbridge to see people that are struggling with these issues. And something that you might have heard about is that these issues are disproportionately impacting communities of color. And so that's a real issue in terms of Hispanic and Black individuals disproportionately struggling with diabetes and food insecurity. And so the numbers below and the colors will continue in the next couple of slides, because these are all coming from a report that was done by CARE, which is the Community Alliance for Research and Engagement. It's co-housed through the Southern Connecticut State University and Yale School of Public Health, and they do some incredible work with neighborhood health research, and so all of this data is coming from them. So the 22% is the level of food insecurity throughout the city of New Haven, and then 12% is Connecticut as a whole. So you can see the low-income neighborhoods are struggling with it more, which makes sense since it's an economic issue. So tying into chronic diet-related and chronic diseases in general, and these colors are the same. The green, the teal color is the statistics for the nation at large. The beige is Connecticut, which falls almost exactly with the national averages. And then the orange is specific to New Haven's low-income neighborhoods. So we can see with asthma in particular, the number is very different with people struggling with that, and that's because low-income neighborhoods tend to have worse air quality due to environmental injustices of the fact that in the state we actually don't have any landfills anymore, and a lot of the trash in Connecticut is burned. And so that's a whole other conversation, but asthma disproportionately affects low-income communities. Diabetes as well. Heart disease is not so different, but really it's the diabetes and asthma I really wanted to highlight, is that the statistics are really impacting these communities differently. And then in terms of the demographic, that Black and Hispanic individuals are far more likely to be overweight or obese. And I think the most staggering number up here is the obese and overweight percentage, that 75% of Blacks and Hispanics are overweight or obese. And it looks a little better in the white population, but it's not good. And we know that obesity is a marker for then diabetes and other chronic diet-related illnesses. And so really brought this up to demonstrate that it's disproportionately impacting communities of color. So moving on to New Haven and why New Haven Farms and why we were started, to give you that background of the state that we're in terms of disease and public health relating to food. So we have 7 farms that are based throughout the city of New Haven. This is a map of New Haven, and we are based in Fairhaven and the Hill. And we have urban farms right within the city, and so I chose this slide to show you that this is one of our farms. And you can see that it's different from a community garden, and that it really is a production farm nestled within an urban area. So we grew directly out of a federally qualified health center called Fairhaven Community Healthcare. And they have a renowned diabetes prevention program that they've been running for almost 20 years now. And the goal of that program is to get families, and I say families because it's really important to not just treat individuals, but treat a whole family, because if one person in the family is at risk for a diet-related disease, the chances of someone else in your family also having that same risk are almost guaranteed, either with because you're sharing genetics some of the time, most of the time, but more importantly is that you're sharing food. And so the habits that you have are going to be very similar to the habits that your children have and that the other people that are under your same roof. And so their diabetes prevention program follows an open source curriculum that the Center for Disease Control has for diabetes prevention. And they adapted it to work in a group setting and also adapted it into Spanish, and now it's open in Spanish. And so our organization does all of our programming in both English and Spanish to have it fully available for all of our neighbors and all of our community members. And so they saw that their program was really effective in teaching people about how to eat properly, talking to people about how to read nutrition labels, and talking to them about eating healthy. But talking only goes so far. If you tell a family that they need to eat more fruits and vegetables, but then they go home and they have to take 2 buses and carry their kids and their groceries to get to the supermarket to get healthy food, talk just ends there. And so what the founder of New Haven Farms did was say, hey, why don't we grow food in these empty lots in the city? And so we grew out of a small project next to Chibasso Bakery, which is a large bakery facility in Fairhaven. It's owned by the same family that started Atticus Cafe and Bookstore. The Nagaro-Dennett family they helped found New Haven Farms, and their daughter works at Fairhaven Community Health Center. So all these connections that kind of grew in a small town that happens like that. And so it really took off in 2012. They approached probably 2010, approached the city and said, hey, can we have some land to grow on? And through the good work of the New Haven Land Trust that has 50 community gardens in the city, urban farming and urban gardening was not something that was new in New Haven. But a farm in the city was different than a community garden. And so in 2012, we became our own 501c3 with this mission of promoting health and community development through urban agriculture. And I really appreciate what Dina said about building that community and building more farmers, because part of the outcome of what we're doing is exposing more young people to growing food, to where is our food coming from, and you'll kind of see some of that in our slides. So our main program that we have, our signature program, is called the Farm-Based Wellness Program. Basically what we did is we took the diabetes prevention program that the CDC has, and we added some interesting curriculum to that. And what makes us really unique from actually any organization nationally is, as far as we know, we are the only production farm in the country that is taking direct referrals from healthcare providers for an on-farm diabetes prevention program. And so that's really exciting because we have access to the medical records the same way that another clinician would. So your medical provider, whether it's your nurse practitioner or doctor, can actually refer you to our program the same way they would refer you to a dermatologist. So right within the medical system, they click, referred, oh, this person qualifies, let's go. So right through a primary care provider, individuals can join the program. We also have other information sessions and community referrals to be more open to other individuals. And so what happens when they get accepted into the program, the first year they do cooking, nutrition, and gardening education with us. So we've taken the curriculum that the CDC provides and we've added to that. And we've added hands-on cooking, we've added garden work with that, and then we've also added, which has been really impactful, even though we dedicate a very small percentage of our time to it, is we've added a short seated meditation to the program. The individuals that come to our program, it's about 90% women, and because in these communities it's mostly the women that are responsible for the nutrition of the household. And if you have ever cooked for your family or been responsible for other individuals, you'll know that you usually come last. So your health comes after your children's health, maybe after your partner's health, maybe after you've cleaned the kitchen and paid the bills and figured everything out, and your health is the last thing on your mind. And really this is an opportunity for women to come to the farm and prioritize their health. Because if they're sick and ill, then at the end of the day, and maybe years from now, they won't be able to take care of their children, and their children might inherit the same illnesses that they have because they haven't learned to take care of your own health. Because we really do have a lot of choice once we're given the opportunity to learn about healthy behavior and healthy lifestyles. And so the meditation has really been this incredible tool to provide a moment of silence for these women that struggle with so much. and it's free. You know, you can meditate anywhere, and meditation really resonates with our population because the population does tend to be religious, and so it's similar to prayer, but has a different bend. It's like, I'm not talking to God, I'm taking this time for myself, to calm myself down and to take care of my own health. And so we've really seen a big impact on helping people's mental health as well. And then they go home with a basket of CSA of produce, a basket of vegetables. And that makes our program different because we're not just telling people about the work that, how to eat healthy, but we're providing them with that food. So next I have a bunch of photographs to kind of show you what our farm looks like and what it looks like in the community. I mentioned that it's family-based and that one individual is referred to the program, and we invite the whole family to come. The first portion of the program, we're actually working on the farm. This is a mother and daughter picking peas and kind of spending time with each other, and it's about building community, not just amongst the family members, but amongst the multiple families, because it feels very isolating if you're struggling with an illness, you're struggling with poverty, but having a community of other individuals that are struggling with similar things, we really facilitate those relationship building. So some more pictures of our participants, big smiles on their faces and growing food with us. This is our participants doing the short-seated meditation under our state-of-the-art, very fancy classroom. So we do everything on a shoestring budget. We grow in parking lots and bring in all organic soil from local farms, actually a farm in Easton, and then do it outside and really connect people with the environment there. Do hands-on cooking education, so people are actually gaining knife skills and learning how to produce a healthy meal out of the food that they're given. And we invite the children to come because we all know that if we can teach someone something at a young age, they'll be able to carry that through with them for a lifetime. And so watermelon is an easy sell, and getting kids to eat healthy food that tastes really good is wonderful. And exciting to see that kids will eat kind of anything if they've grown it themselves. And so that's an exciting thing to see. This is one of my favorite pictures showing the families walking off the farm with their big basket of produce for the week, so they're really taking home a lot of food to bring to their family. In year 2 of the program, people are then offered their own community garden space, so then they can bring that to their own community. Give a man a fish, you feed him for a day. Teach him how to fish, you feed him for a lifetime. With gardening, for me, I say give someone some vegetables, you fed them for a day, but teach them how to farm, teach them how to garden, and you're feeding them for generations. Because if you teach their kids how to farm, they're also going to be more independent and be able to take care of their own health. So we also have a farm stand, so we have other ways of getting our food within the community. We accept SNAP and WIC, which is the kind of modern food stamps, to really get that food out to our community members. This work would not be possible without working with so many different partners, and so our organization was founded and is really closely connected with so many other nonprofits in the city, and we can't do this alone. You know, it's staggering numbers we're looking at, and so I appreciate what Dina said in terms of, you know, building this community that supports agriculture and that really prioritizes this kind of work. So this is a view actually from the bridge, and that wind turbine is at the base of that is where one of our big farms is. And so next time you go over the Q Bridge and see the wind turbine, you can think that at the base of that there's a productive organic garden that is growing food as medicine for our community. I would be remiss to not do a plug for our seedling sale. So we do also have a seedling sale on Memorial Day weekend, and so if you are a fan of dahlias, which are personally the reason that I farm, because I'm obsessed with dahlias. Yeah. I love the food, I love the work, but dahlias really captured my heart. So we'll be selling some dahlias that I grow as well there. So come visit us. I have information about how you can get involved with us, whether that's volunteering or if you have the means to donate to support this important work. And I'm excited to continue the conversation, so thank you.